Vitamin A is undeniably essential for healthy growth and development in children, but the danger of megadosing, taking excessively high amounts, cannot be overstated. Children are particularly vulnerable to vitamin A toxicity because their smaller bodies and developing organs are more sensitive to imbalances in nutrient levels. What might be a tolerable dose for an adult can quickly become harmful for a child, sometimes with severe or even life-threatening consequences. The risk of overdose is heightened when parents or caregivers administer high-dose vitamin A supplements without proper medical supervision, often in an attempt to boost immunity or support growth, not realizing the potential dangers they are introducing. One of the most alarming manifestations of vitamin A toxicity in infants and young children is the bulging of the soft spot on the top of the head, known as the fontanelle. The fontanelle is a gap between the skull bones in babies that normally closes as the child grows. When vitamin A levels become excessive, increased pressure within the skull can cause the fontanelle to bulge outward, a serious sign that the brain is under distress. This increased intracranial pressure can be accompanied by symptoms such as persistent vomiting, irritability, lethargy, and headaches. If left untreated, it can escalate to seizures, coma, or even death. The presence of a bulging fontanelle should always prompt immediate medical evaluation to determine the cause and prevent permanent damage. Vomiting is another common early symptom of vitamin A overdose in children and serves as the body's attempt to expel the toxic excess. However, repeated vomiting can lead to dehydration and electrolyte imbalances, compounding the child's health risks. Additionally, children suffering from vitamin A toxicity may experience poor appetite, irritability, and swelling of the long bones, reflecting the vitamin's harmful effects on growing skeletal tissue. These signs are often subtle and can be confused with other illnesses, which can delay diagnosis and treatment, increasing the likelihood of complications. The danger extends beyond acute symptoms. Chronic exposure to high levels of vitamin A can interfere with normal bone development, leading to abnormal bone growth, pain, and increased risk of fractures. Because children's bones are still growing and remodeling rapidly, any disruption in this process can have long-term consequences for stature, mobility, and overall musculoskeletal health. Furthermore, excess vitamin A can impair liver function in children, just as it does in adults, posing risks of liver enlargement, fibrosis, and in severe cases, liver failure. Unlike adults, children have a narrower margin of safety for vitamin A intake. The developing brain and nervous system are particularly susceptible to damage from toxicity, making neurotoxic effects such as increased intracranial pressure and neurological impairment more common and severe in this population. The long-term effects of vitamin A toxicity during critical periods of development are not fully understood but raise concerns about potential impacts on cognitive function and neurological health later in life. Another important consideration is the source of vitamin A. Preformed vitamin A, found in animal liver and supplements, carries the highest risk for toxicity in children because it is readily absorbed and stored in the body. In contrast, beta-carotene from fruits and vegetables is generally safer, as the body regulates its conversion to vitamin A according to needs. Despite this, parents sometimes unknowingly provide children with high-dose supplements or liver-based foods in excess, mistakenly believing more is better. The risk of overdose is particularly acute in regions where vitamin A supplementation programs are implemented to combat deficiency-related blindness and immune disorders. While these programs are crucial for public health, improper dosing, lack of follow-up, or combining supplements with high dietary intake can lead to accidental megadosing. This highlights the necessity for strict protocols, careful monitoring, and clear communication with caregivers about appropriate dosages. Medical guidance is essential before administering any vitamin A supplements to children. Pediatricians and healthcare professionals can assess individual risk factors, dietary intake, and health status to determine if supplementation is necessary and to recommend safe dosage levels. Parents and caregivers should always follow these professional recommendations and avoid self-prescribing or using over-the-counter supplements without consultation. Education on the dangers of megadosing is critical, especially given the prevalence of vitamin and supplement marketing that often downplays potential risks. In conclusion, while vitamin A is vital for children's health, the risk of toxicity from megadosing is a serious and sometimes overlooked threat. The sensitivity of children's developing bodies means that excessive intake can quickly lead to dangerous symptoms such as bulging fontanelles, vomiting, neurological impairment, and even coma. Chronic toxicity can disrupt bone development and damage the liver, with long-term health consequences. Careful management of vitamin A intake through medical supervision and education is paramount to ensure children reap the benefits of this essential nutrient without suffering from its potentially harmful effects. Avoiding megadosing and adhering to professional guidance are crucial steps in safeguarding children's health and development.